Did you know that over 200,000 medical records were just compromised in a single cyber attack? That's not just a number, it's hundreds of thousands of real people with real lives suddenly exposed. And here's the scary part. You might be next. This isn't some distant threat, it's right here, right now, and it's closer than you think. This isn't just another headline scrolling by on your feed. It's a warning shot, a wake-up call for every single one of us. The digital world we rely on for our health and safety is under attack, and the consequences are more real than ever. If you're watching this right now, you've already taken the first step to protect yourself, awareness. But don't stop here, keep going, take action, because the threat isn't going away on its own. Just this morning, one of the largest hospitals in the United States was hit by a massive cyber attack. The fallout? Surgeries were shut down, patient systems frozen, and lives put at risk. Imagine the chaos, doctors unable to access critical information, patients left waiting, and families desperate for answers. The hackers behind this attack? Still a mystery. Their motives? Unclear. But the damage? It's growing by the second, spreading like a virus through the digital veins of our healthcare system. Let's talk numbers, because these numbers are terrifying. Over 200,000 medical files potentially stolen and now out in the wild. That's not just names and addresses, that's medical histories, insurance details, even social security numbers. The kind of information that can ruin lives if it falls into the wrong hands. 72 hours. That's how long the hospital's systems were down. 3 days of total chaos, surgeries postponed, treatments delayed, and patients left in limbo. For some, those hours could mean the difference between life and death. And the financial cost? $4 million lost in just a few days. But that's only the beginning. The real price tag includes shattered trust, lost time, and the emotional toll on patients and staff. And it gets worse. 70% of nearby hospitals reported attempted breaches within just hours of the first attack. This wasn't an isolated incident, it was a coordinated assault on our entire healthcare infrastructure. The ripple effects are still being felt. Let's cut through the noise. This isn't just a glitch or a technical hiccup. This is a full-blown crisis, and it's exposing just how vulnerable our hospitals really are. What we're witnessing is a nationwide stress test for our entire healthcare system. Hospitals everywhere are scrambling to respond, government officials are holding emergency meetings, and IT teams are working around the clock. Imagine walking into a hospital, sick or injured, and your doctor can't even pull up your file. No access to your medical history, your allergies, your medications. It's not just inconvenient, it's dangerous. Lives are on the line. Trust, something hospitals have spent decades building, can be shattered in an instant. Patients and families are left feeling helpless, anxious, and betrayed. This could be the beginning of a new kind of warfare, one that doesn't need bombs or bullets, just code and chaos. Cyber attacks like this can cripple entire cities, disrupt emergency services, and put millions at risk without a single shot being fired. Security analysts are already pointing fingers at a foreign, state-sponsored group. The evidence is mounting, and the implications are chilling. This isn't just about money, it's about power, influence, and control. You heard that right, this attack may be the first strike in an invisible cyber war, with American lives caught in the crossfire. Our hospitals, our data, and our safety are now battlegrounds in a conflict most people can't even see. The FBI is on the case. Homeland Security is scrambling to respond. Cybersecurity experts are working overtime, but the threat is evolving faster than ever. The question is, are we ready for what comes next? This isn't just another news headline to scroll past, this is serious, this is personal. It affects every one of us, whether we realize it or not. So what can you actually do to protect yourself and your loved ones? It starts with simple steps, but they matter more than ever. First, update your passwords. Right now, not later. Use strong, unique passwords for every account, especially anything related to your health or finances. Don't reuse old passwords, and consider using a password manager to keep track. Back up your critical files, especially health records or anything sensitive. Use secure cloud storage or an encrypted external drive. If your data is ever compromised, you'll have a safe copy to fall back on. Don't click on sketchy links, even if they look like they're from your hospital or clinic. Phishing emails are getting more convincing every day. Always double-check the sender and never share personal information unless you're absolutely sure. And if you work in healthcare, double-check your systems, stay alert for suspicious activity, and report anything unusual immediately. Your vigilance could be the difference between safety and disaster. This isn't science fiction. This is happening right now. Hospitals are under siege and the threat is only growing. We all need to take this seriously. If any of this shook you, even a little, hit that share button. Let people know what's really going on. The more people are aware, the stronger we all become. And drop a comment below. Would you trust your hospital with your data today? Or are you rethinking everything you thought you knew about digital safety? The world needs to wake up before this becomes the new normal. Stay sharp, stay safe, and remember, your data is only as safe as the systems that protect it. Don't wait until it's too late.